and Chris on the show on KMOX. Good to have you with us this morning as we go back to our guest line. Paul Seegert is the managing partner of PCS Advisors who joins us this morning as there is a new weight loss drug that is in the works, and we're trying to find out just how people are going to pay for it if they are. And Paul visits with us on KMOX. Good morning, Paul.
Good morning. Thank you for having me.
Well, weight loss is the goal of so many Americans. We do struggle with obesity in this country. We just had the new year for people resolution. A lot of them, perhaps the number one resolution for Americans is to lose weight. And this is a groundbreaking weight loss drug. There have been a few of them that are in the process of being approved by the FDA or have been recently approved. But when we look at drugs like this, they're $1,300, $1,500 for a month's supply. So my question is, how are people going to afford $18,000 a year for a weight loss drug? And what role will insurance play in that, the pricing and the cost of that drug?
Well, the big play here for these drug manufacturers is to get these drugs covered by insurance and to do what we've done with our system for quite some time, kind of hide this actual retail cost or total cost inside of your premium. And then we'll all scratch our head at renewal and say, why the heck did our insurance premiums go up yet again? And most consumers will get access to these things at a fairly small copay if it works out the way that Big Pharma would like. And then we potentially, to me, this is one of the biggest stories going on right now. We have the potential to add $100 billion of additional cost to our healthcare system in a pretty short period of time if these all get approved and get covered by insurance the way that it looks like they might.
I want to make sure I'm pronouncing this right, but it's tirzepatide. Isn't that the name of the drug and how it's pronounced?
Yes.
Okay. So this is one that's been fast tracked. There is this estimation that it could hit a record of $48 billion in annual sales. So we could get to that point, and it could be the best-selling drug of all time. How quickly, if this thing works and this drug does what it says it does, because there have been all kinds of weight loss drugs out there over the years, if it does what it says it does safely, are these estimates correct?
I would think so. And in fact, just yesterday, the American Academy of Pediatrics came out, and they're now recommending, which is a pretty much a 180, they're now recommending weight loss drugs and surgery for children, which would open up. So essentially the entire population would be opened up to this. And as you pointed out in the intro, we're a country that gets heavier every year. And it pretty much fits right into our culture that, let's get a pill for this. And we don't really look at cost, and we shield the consumer from knowing what real costs are. So I think this conversation we're having is really important because there's just no way you can add $100+ billion to the system. We're on the verge of creating the best-selling class of drugs of all time without all of us shouldering that cost. It will show up for sure in our premiums.
So what is the most important, you said this is an important conversation to have. What is the most important thing that we should be talking about when we talk about a weight loss drug like this?
I think we need to talk about, as a country, do we really want to go down the road of medicating for all of these conditions? I think the drugs could be very important and very powerful and a very positive thing. Should we apply them globally, or should they be for more extreme cases? And should we continue to try and have a conversation or work harder at having a conversation around lifestyle changes that could prevent the need for a lot of this? I mean, we've got a lot of work to do there. It's not just two choices, drug or not. There is a third, and I think we've got to talk about the way that the driving factors that are resulting in all of this.
Yeah, when we look at the United States and the healthcare system and what's needed to improve it, change it, it can be difficult to compare the United States to other countries that have more centralized or universal health care programs, partly because the United States does deal so much with obesity and other issues. It's a very expensive health care cost on the country. What role do the pharmaceutical companies have in not charging exorbitant prices? I don't know what it costs to manufacture this drug. $1,500 a month for a supply for one person seems high. Just in the same way that I would say no one's holding colleges accountable for ridiculous tuition. Right. Is anyone holding pharmaceutical companies accountable? And I know, capping the cost is a dangerous conversation as well. But what do you do if it seems that pharmaceutical companies seem to be gouging the public for these medicines?
Yeah, I'm a free market person. I believe in the free market. We don't actually have a free market in healthcare in this country today, and drugs are a perfect example of that. It's more capitalism run amok, where they can charge just about whatever they want. And it's interestingly to me, it's an unintended consequence of the Affordable Care Act. When to use your loan example or for your college education example, when loans became prevalent, tuition went way up. They didn't have to look and say, what can a student afford? Same thing with the Affordable Care Act. We took a lid off the top of what a claim could go to and what lifetime maximums could be for the cost of care. And before that, we rarely ever I never saw a single person in my whole career who ever exceeded the top end of that. And that once that lid was taken off and they say there's no lifetime maximum, all of a sudden we saw costs just go through the roof. So it kind of had had a very strong unintended consequence. So you look at that, our system, which says there's no cap, and the fact that we hide all the information that a consumer would need to consume effectively. I mean, free markets, you have information to cost and quality when you consume things. We don't have that easily here. You've got drugs that are going to cost $1,500 a month, but you're going to feel as a consumer like it costs $10 or $20 or $30 or $50, depending on your health plan. And so you're going to be kind of lulled into this sense of, hey, this is affordable, this is reasonable, while the system is really getting plundered behind the scenes. And that's a big problem that we have. We need to fix that. We need a free market, and some common sense guide rails could be put in place to encourage that. And then the other thing that really is alarming to me is the fact that we continue to fund 85% of the global profit margin for the drug business globally as American consumers. That's not reasonable. Something needs to be done about that as well.
So then there should be caps on what drug companies can charge and what insurers end up having to pay. Like that is reasonable, right?
I think that is reasonable. I mean, you have to do something. I mean, they have these periods of exclusivity which are intended to reward them for research and development. But we have to have all the rest of the world says, we'll buy your drug, but we're going to pay, $500 for it. So they turn around, they charge the American consumer $5,000. That's not reasonable. That shouldn't be allowed to occur, but it does. So we need to do something to encourage free market forces to go to work. Why should we pay wildly more than the rest of the world?
So then how do we encourage that to happen? Because I don't think there's anybody listening who would disagree with the idea that drug companies should not be allowed to charge like 5,000% more here than what they charge somewhere else. What's the call to action here?
Okay, I have the answer to this, and that is, in one word, it's called transparency. If this was all out in the open, you would have a lot more uproar about it. And a consumer should be able to know when they get a prescription, how much does it cost and where did all that cost come from? Who added it all? There are middle players in our system here that are unique to the American model that do not make drugs, they do not wholesale drugs, they do not retail drugs, yet they can represent 30, 40, 50, 60% of the cost that a health plan pays for that drug. And that's become wildly inefficient, and it's only occurred because we have not required transparency. We need transparency, and that'll be the first step towards real free market forces going to work in competition.
That's really interesting, and how, again, drug companies should not be able to charge the American public more than they're charging other people. at the same time, we appreciated that it is financially rewarding for companies to innovate and come up with new drugs like the vaccine, like the COVID vaccine. There was incentive for companies to throw their resources behind that. So like you said, it's not that you're swinging one direction or the other. We need an ability to balance it out. And right now in the United States, there's no balance.
That's right. And you can look at hospitals. It's another great example of this. We've got hospitals that are closing in rural areas, leaving poorer areas, even though they're nonprofit, moving toward richer areas just to survive. And they're doing it because the government programs don't reimburse them enough to survive. They actually lose money on government payers, Medicare, Medicaid. And so they need to go where there are commercial payers. Well, part of what we were going to do as a country to help kind of solve all this was the transparency rule that came out a couple of years ago, where hospitals are supposed to report what they charge. And what we saw was, still very few actually are in compliance because the implementation has been so weak. It sounded good, but when you have a fine that's not even a rounding error to the finances of a hospital, it's not been enforced well. So here we are. We're not a whole lot closer to the result that we wanted, but the idea was good. As a consumer, we should know. And what we saw was, an average hospital has more than 150 prices for every procedure they perform. Why is it that an employer plan person shows up and they might bill that person 3.5 times what a Medicare or Medicaid person pays? In some states, it could be as high as a tenfold difference. We need transparency around that so that we can all have a good conversation about it. You should know in advance. I'm going to get my knee replaced. It's going to cost this much over here and this much over there. And I should get quality scores, too. I can do it for just about everything else right on my smartphone. And it's not that we lack the technology. We just lack the enforcement of some common sense rules of play.
So is the thing to do to put pressure on your congressman? I don't know what else there is to do for people.
Yeah. I think that is the best solution would include, where the only way we solve it nationally is to include government in some setting up guardrails. That's what they're there for. They're supposed to be a referee, and we all want a free market. That's the reason most of the innovation, medical innovation in the whole world comes from this country. We have the best healthcare in this world. We're just really dumb about how we pay for it. But we have the best. People come from all over the world to get their healthcare here when they can afford it. So we do need help from Congress to put in some common sense guardrails and some transparency rules. People ask me all the time, when will that occur? Well, my funny, maybe dark humor is to say, well, as soon as lobbying doesn't work, that'll happen. But that's the sad reality is if you took all the top 10 largest lobbies in this country, number one is healthcare. And you add up the other 9, they don't add up to what gets spent on healthcare, even including defense. It's a massive amount of precision donated money that keeps things kind of as they are. But I have to believe we're getting toward a breaking point. You can't have this thing just running out of control and eating up our entire economy and household budgets the way it has been into the future. It really isn't sustainable.
Paul Seegert, we really appreciate your time today. Thank you for taking that time, and hopefully we'll talk again soon when we get we get a little further down the road on this.
Thank you for having me. Have a great day.
That is Paul Seegert, managing partner of PCS Advisors.